For the ADHD diagnosis, there's no definitive test for ADHD, no blood analysis or brain scan, or no genetic screening. So, evaluating and diagnosing for ADHD is not a quick or easy test. So, uh, doctors use MRI for identifying people with attention deficit hyperactivity disorder or ADHD from patients without the condition, and according to a new study published in Radiology. So the images from MRI also help distinguish the subtypes of ADHD. So although the etiology and neurobiological substate of ADHD remains unknown, evidence from imaging studies suggests that those individuals who suffered or who has a condition have alteration in brain volume, cortical morphometric features, and diffusion properties of white matter of the brain. So there is fifth edition DSM-5 that helps to diagnose the ADHD. So there is a criteria for ADHD in children. First is inattention. It is where there is 6 or more symptoms of inattention for children up to 16 years of age, and for the adolescents of 17 years old and older, and adults. So symptoms of inattention have been present for at least 6 months, and they are inappropriate for developmental level. It could have often fails to give close attention to details, or during the school or at work or even in other activities. Then there's often trouble in attention or play activities. So most often those patients or clients does not seem to listen or does not follow through instructions in the school or in the chores or duties at the workplace. So it often has trouble organizing activities and tasks. So also it avoids, distracts, and reluctant to the task that requires mental effort. And it often loses things necessary for the tests and activities. Like for example, the pencils, books, or keys, or paperwork, or mobile phone. They often forget where they put those things. So there is also an often easily distracted and often forgetful in activities, in daily activities. So second is hyperactivity and impulsivity. So 6 or more of the symptoms below are considered ADHD up to 16 years old, or 5 or more for adolescent age of 17 years and older for adults. So it is at least for 6 months to extent that it is disrupted and inappropriate for the person's developmental level. So the client often projects with or taps hand or feet or squirms in seat. So the client often leaves seat in situation where remain seated is expected. Often runs about or climbs in situations where it's not appropriate for the adolescent or adult to be limited and restless. So often unable to play or take part in leisure activities quietly, often on the go, or as if it's driven by motor. So often talks excessively and blurts out answers before question has been completed. So they have trouble waiting their turn. Often interrupts and intrudes on others. In addition, the following conditions must be met, like several inattentive or hyperactive impulsive symptoms were present before age 12. Several symptoms are present in two or more settings, like home, school, or work, with friends or relatives in other activities. So there is clear evidence that symptoms interfere with or reduce the quality of social, school, or work functioning. The symptoms are not better explained by other mental disorders such as mood disorder, anxiety disorder, dissociative disorder, or personality disorder. So that the symptoms do not happen only during the course of schizophrenia or psychotic disorder. Based on the symptoms, there are three kinds of presentation of ADHD can occur. Combined presentation, predominantly inattentive presentation, and predominantly hyperactive impulsive presentation. So the combined presentation, if enough symptoms of both criteria of inattention and hyperactivity, impulsivity were present for at least 6 months. So for the predominantly inattentive presentation, if enough symptoms of inattention but not hyperactivity, impulsivity were present for the past 6 months. So predominantly hyperactive impulsive presentation, if enough symptoms of hyperactivity, impulsivity, but not inattention were present for the past 6 months. So because symptoms can change over time, the presentation may change over time as well. So for the adult diagnosis in ADHD, it often lasts into adulthood. To diagnose adults and adolescents for the age 17 years or older, only 5 symptoms are needed instead of 6 of the needed symptoms in the younger children. So symptoms might look different at older ages. For example, in adults, hyperactivity may appear as extreme restlessness or wearing others out with their activity. So 5 or more symptoms of inattention, of hyperactivity, and impulsivity must have been persisted for the past 6 months. So that is inconsistent with developmental level and negative impact on social and academic occupational activities.